Hey,
Hi.
I feel like I know you already.
Okay. Where from?
Your video with Lila, and
Oh.
I'm a patient of Dr. Morgan's.
So, a lot of connections.
Yes,
Nice meeting you. So,
Lynn.
Lynn.
Lynn
So,
Margaret. Yeah.
I'm also Lina, so they told you
yeah.
already. So we have similarities.
Yeah, for sure. Lynn Harris. I'm 61 years old. I live in Calgary, Canada, and I came to Lithuania to get a hip operation.
So, your both hips are pretty damaged. The left
Yes.
one, maybe it deteriorated much quicker than the right one.
Yes, it did. There's a lot of wait list. I was on a wait list in Calgary for these hip operations. It was diagnosed in April, but it had been coming on since the end of 2019. In the end, the wait list was longer than I could stand the pain.
The patient decides, for example, he said, I have more pain with the left one. I need the left one fixed first. So.
Well, the problem I have is that this affects. So this side affects my. I can't actually unwrap myself, but it affects my left knee to the point where I know there's nothing really wrong with my left knee right now. So if I get this one fixed, this one is still very stable.
Yeah. So try to loosen up a bit. Yes.
Okay. Yeah.
This is the movement that's most painful. And the pain goes
Up here.
up here. Okay.
Yeah.
How much can you flex?
Oh.
This is without any hands. This is,
Oh,
yeah.
no.
But again, when you do this, you cannot.
Nope.
It's just this motion.
Yeah.
Okay. And the other one, just
Well,
less.
okay. I'll just.
It does not cause so much
No,
pain.
not as much, no. I don't like doing housework. I will say this. I don't like doing housework, but not being able to do it is different than not liking it. And I would love to clean my house, without any physical problems, or change a light bulb. I got up on a chair a month ago to change a light bulb in the ceiling, and I have about 9-foot ceiling. So I was up on a chair. Wow, to get up on that chair, was that ever hard? And I was worried I was going to fall off. So, and things like that. So yeah, I look forward to just doing everyday things.
So, how's the morning?
Good.
Good.
Busy.
How's the food?
Good.
So,
That's what I was doing.
yeah.
Overnight.
So just try to avoid like
Yes.
this one.
Yeah,
This
just straight.
this one it's okay.
Yeah.
Yeah.
Straight back.
And you can see that it's up to 90 degrees now.
Yeah.
So it's okay. So you can sit down,
Yeah.
walk, and do whatever you like.
When I had the original interview with Dr. Miller in Calgary for the original consulting physician, he explained to me, because I talked to him about all those options. I did. I said, what about going to Toronto? Toronto's a few thousand miles from Calgary, but it's still in Canada. But he says, he says, yeah, but it'd be the same. He says, all that's going to happen is you're going to go in. You're gonna stay for a couple of days because after you fly, just like I did here, you're gonna stay in a hotel. So you're gonna do your flight, you do your hotel. You're gonna do 2 days in the hospital. They're gonna release you on your own, and then you're gonna stay in a hotel for another day or two so that you don't develop blood clots. Then you're gonna fly back to Calgary, and then you're gonna do your own physio. And he says nobody should be out of the hospital with this type of operation in 2 days. He said it's just not right. He says, and it's going to cost you $30,000 plus the flight, plus the hotel rooms and all that stuff. Like I told friends at home, all of my fears proved to be unwarranted because it was such a welcoming, even from the first day, it was so welcoming. And even before the first day, the person that the tour or the person that was making all the arrangements, Marius, he really thought of everything. With our trip, everything was just perfectly timed and perfectly executed and no worries. And I was telling Dr. Morgan last night, the family friend of mine that had his knees done, as I texted them, him and his wife, and I said, other than the operation at the beginning, I said, it's almost like you've been to a spa. There you worked out a lot, you had really, really good food, and then you had really good rest.
How do you think your life will change after you are fully healed? What will you regain from
Well, just rib gain your whole life. Yeah.